circumcised. So men who are not circumcised, what we would do is actually retract their foreskin, and you have to cleanse around the glans, penis, but you have to replace the foreskin so that they don't actually, because it can form a constricture and then cause circulatory problems. So that's the thing with men, and the women is the front to back thing. All right, sir. Now, can you pull up the other rail over there? And I'm going to have my gentleman, sir, I'm going to turn you over. You should pull the foot. Yeah. I'm going to have you turn over here onto your right side so I can wash your back then. And so if you were helping me, you could grasp this, and I'm going to have you, and where you put your hands is not using your fingers, but just the palmar surface of your hand on their chromium process, and right here. Yes. So you would hold him like that if necessary. And now I'm going to. Got all these metal. So now I could be washing his back. This is when I would change the water, having done his feet or having done his perineum. And now I'm going to wash his back. All right. And I'm into the. I'm way into the tons of soapy water. I love the squirt bottle thing too. I'm all over that.
I use just extra cup.
Oh, and do that like
full
that.
Water.
Yeah, I'm into really getting people soapy. I walk by and you claim you bathed your patient and I can smell odors, I'm going to be like, hello, come on down. Your take on a bath is different than mine. Okay. So I would pat him dry, and this is my opportunity to look at his perianal area and so on. I actually don't love these because these are like way rough, and I think that they can cause skin breakdown. So I love those other whites if you can use them, to be honest with you, and so on. But I could wash around his perianal area, and then this now would need to go in my in my soiled linen hamper. And remember, anytime somebody's on their back and say, "Oh, hey, Mr. James, while you're here, I'd like you to take some big deep breaths for me." I got my stethoscope around my neck or in my pocket, and I'm listening and bearing both sides, and that gives me a chance to make him. Can you take a big deep breath for me? Can you take a big deep breath? Even bigger breath for me? Even bigger breath, and so on. Dependent sides down tend to have less lung expansion, so I'd be most likely to hear atelectasis in this area when his chest was down. And then I'm going to be pressing on his sacrum because I'm checking for. Thank you. Sacral edema. I'm looking at his ischial tuberosities. I'm looking at his heels. And then I say, you know what, Mr. James, while you're here, if you can hold on right there, I'm going to go ahead and change your bed. When you turn somebody side down, since it does change their lung expansion, make sure they're not over there getting cyanotic. Thanks. You want to hang on to that? So now I could. Thank you. There's some linens over there. I guess I'll go ahead and show you the bed changing thing. Do you want to grab that linen stack right there for me? Okay. Eyebrows coming off. We'll fix them later.
Can you change the bed?
Are you okay, Mr. James?
No.
Sounds good. Tell you what, I'm going to go ahead and change your sheets for you right now and get you in a nice clean bed, and then I'm going to position you over on your side, and then we'll turn you back over. Is there a... I actually love the bed film, though. I know it's neurotic, but I'm going to show it anyway. Okay. So we don't have our linens folded appropriately here, but in a hospital they are folded exactly so you can drop them in the center of the bed and go and the center seam lines up. But we have people who aren't nurses, so they never get folded right. But I never have to wonder whether or not there's going to be enough sheet for the other side of the bed. This does happen to be a fitted sheet, but there are flat sheets as well.